Hi, I'm Amie Clark, co-founder of theseniorlist.com. You may know that there are many different types of dementia, but today I'd like to cover one of the most common types that you may not be familiar with, called Lewy Body Dementia. I'll be interviewing licensed clinical social worker Jill Johnson Young, who is the CEO of Central Counseling Services in Riverside, California. She specializes in grief and loss, end of life, and dementia. She's a national speaker and has written books for children and adults on grief. Jill also happens to be a double widow, and her second wife, Casper, died of Lewy body dementia. Jill and I will discuss the signs of Lewy body dementia, how to get a diagnosis, resources for caregivers, and much more. I'll include the links to where you can find Jill and her online resources in the description below. Hi, Jill. Welcome. Thank you so much for joining me today.
Thank you for having me. I'm so glad to be here.
Likewise, we are so happy that you agreed to participate in our educational videos. Today, we are focusing on Lewy body dementia, a topic that you know all too well. As I mentioned earlier in the introduction, you have not only personal but professional gads of experience with Lewy body dementia and supporting families along their journey. So I thought we would just start out with kind of covering the basics. What is Lewy body dementia?
Lewy body dementia is, in my opinion, one of the worst of the 12 dementias. Not to tell anyone who's got another dementia in their home that theirs isn't bad, because they're all bad. Somebody's brain being attacked is never a good thing and never makes good quality changes in anyone's lives. But Lewy body is different in that if you've ever watched Star Trek and seen The Trouble with Tribbles, that episode, the Tribbles are the Lewy bodies. They look like little white dots. They're hard to spot. They're not something that most neurologists, and especially not that most radiologists, look for. And with my late wife, who died of Lewy body dementia, they were misdiagnosed as having dozens of TIAs, trans-ischemic accidents, for the first 2 years, when in fact it was Lewy bodies doubling and redoubling in her brain. And what Lewy bodies do is they start typically in the base of the brain, and then they migrate anywhere they want, and they migrate at will, and they redouble and redouble and redouble. That's oversimplified, but a Lewy body is a protein that doesn't belong in your brain. The different thing with Lewy that makes it a hallmark is that it comes on with both Parkinsonism and full-on dementia symptoms and psychosis, typically all at the same time.
Wow.
And the person who has Lewy body coming on recognizes things are wrong, but like everybody with dementia, tends to not say anything for about the first 2 years. 2 years is kind of the outlying, okay, I can't hide this anymore, I'm exhausted, something's wrong, raise the red flag moment. When it's early onset, it's much faster. My late wife was dead at 57, just before her 58th birthday, and we had about 3.5 years of Lewy in that time. It goes 0 to 5 years. That's about all you get in early onset. It can go much longer, but it tends to be a faster dementia than the other dementias, such as Alzheimer's, which has sort of a broad spectrum of how long it can take to do what it's going to do and to kill somebody, because all of the dementias are terminal illnesses. There's no way around it. And it's not something doctors like to say, but it's very true. Dementia will, in fact, take your life. With Lewy body, though, you lose your memory and then it comes back. And then you lose your memory and then it comes back. And you become psychotic, which can look like just checking out. It can be like my late wife, who thought we were getting messages from the television and we had to watch NCIS every morning, and Jethro would give us our orders, and that would come through whatever mechanical thing happened to be nearby in that moment, right? But then you come back and you remember you were psychotic, and you remember you lost your memory, and you remember you couldn't remember your wife or your kid's name, and you remember you were back in 1955. And then you came back. There's a guy named Norm Mack who's in England who's written books about this experience because he's a long-term Lewy body patient. And he describes in his website and in his books what it's like to be checked out and to know he's psychotic and to not be able to break through it and make contact with other people. So
Wow.
it's also painful because Parkinsonism is shakes, and then eventually the shakes seem to disappear. My wife's pain and other people's pain tends to escalate at that point. Again, this is a dementia, so everybody is different. But in general, the pain escalates, and that seems to be because the spasms are still there. They're just not expressing themselves physically. So they experience them, we can't see them. It's exhausting. People with Lewy body need to rest all the time. And that's different from all the other dementias where you see books saying, now you should get up, you should make them walk, make them do this and that and the other. Lewy is the complete opposite. They don't have the energy to do those things. And they get misdiagnosed because of their symptoms coming and going and because of their energy level.
Yeah, it seems to me in the research that I had done, actually looking for experts like you to speak about this topic, that one of the reoccurring themes that I heard from professionals that reached out to me was that it is so misunderstood, even by physicians and neurologists who specialize in, cognitive disorders, that it's just one of those that easily slips through the cracks, which to me is absolutely heartbreaking.
It makes no sense, and it's head to toe. It causes GI symptoms. It causes, to be very constipation. It causes drooling. It causes head tilt. It causes, like everyone else, the loss of sense of smell and taste. But it's a little more profound. And it causes immediately that mask. So someone with Lewy body looks angry all the time. People would misunderstand what my wife's face looked. I would have to look at her eyes to see if she was smiling, because she could no longer express herself about 6 months in. It was just an immediate mask. And so that puts doctors off too, because they think the patient's angry with them, and then they get hesitant, and the patient can't tell them verbally or show them with their nonverbal expression where they are emotionally. Yeah.
And that actually leads into one of my questions. I was going to save it for later, but it seems appropriate to jump into it now. So what would you say to families who may be seeing some of these signs that you're describing? What would your advice be as far as helping their loved one out?
I would take the checklist, which you can get from the Lewy Body Dementia Association. It's also on my website. It's on a bunch of other websites. Take the biggest checklist you can find and highlight every single one that you've had and put the dates when they started. I would also create a medical notebook, and I would track all of the behaviors, all of the physical symptoms, all the pain, changes in appetite, changes in ability, right? So is your loved one suddenly unable to use a fork, knife, and spoon? That's not unusual with any dementia. It comes on a little faster with Lewy in general. But again, Lewy is its own little animal. And when Lewy combines with Alzheimer's, it may be faster, because Lewy runs concurrently a lot of the time with Alzheimer's and with a few of the others. Very few people have just one dementia. Casper was one of those. She just had Lewy, but she had early onset, so she didn't have time for the others, right? And she was healthy other than Lewy, completely healthy. So you want to make sure you're documenting everything. And then you go in to see the neurologist. What I would do, and what I did do, was create a list every time we went in. And as I was signing in at the doctor's office, I made sure that list went over to whoever was back there with a note that said, the doctor has to read this before I get there. I don't want him reading it in front of her. And then when I was in the doctor's office with her, and with dementia, I don't care what the rules are for COVID, you got to be in there. You have to have a caregiver in the room. Don't let anybody block you at any time, ER, hospital, doctor's office, you are going to be there, or your loved one's not going to go, because that's not somebody who understands dementia. That's just not okay. Right. And then I positioned myself so my wife was in front of me, facing the doctor in front of her, and I was behind. That way, when the doctor was talking to her and doing the MMSE, what day is it? What week is it? What season is it? Yada, 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 which every dementia patient practices on the way to the neurologist to see if they can fake out the doctor and not feel bad about themselves. Most importantly, I could sit behind and not have the heartbreaking need to look at her smiling while she was getting it all wrong, because she looked to me, of course, for confirmation and support, as every patient does. But I could also, when she said things are fine, go, no, no, can't eat, right? I would do the hand signs so that he had an idea of what was real, in addition to reading the letter. And then he would step out with me and have her lay down and say, you look really tired, why don't you rest? And we go down a hallway and around the corner so she couldn't overhear. And he'd check what I had put in the content of my letter that day.
I think that is such tremendously good advice. And even for people who perhaps this isn't their main concern, but just as an advocate for a loved one, writing out your concerns beforehand. I remember doing that with my grandmother because I didn't want to embarrass her. I didn't want to bring up my own concerns in front of her. I knew that would just make her upset. I knew it would make her angry.
It's heartbreaking to do that.
Yeah.
And medical providers will do that in the hospital, right? We go to the hospital for tests and the nurse is looking at me and Casper's laying right between us. And I said, don't talk to me. Your patient is there.
Yep.
If you need more information, you come find me after. You talk to her.
Yeah.
Stop it.
Yeah, I know. It's part of being a good caregiver is making sure that we're still preserving, even if it's
all the dignity possible.
Dignity, yes.
And all the safety, because sometimes they also forget, bed rails, and people with Lewy are not like other dementia patients. They figure things out. Casper would go over bed rails. She had no problem with that. So you couldn't turn your back on her. And I've talked to other Lewy families and they're having the same experiences. In fact, in our group this weekend, we've got 2 new families, both coming in with Lewy, because they can't find anyone in the other support groups who understands that they can't do the things that everyone else is advocating, exercise, go on walks, do puzzles. Seriously? It doesn't work with Lewy.
How common is Lewy body dementia?
There's a debate. And the reason for the debate is how common something is depends on the death certificate. And so if the doctor doesn't put Lewy on the death certificate, then it's not Lewy. And lots of doctors at the end of life go to just dementia. And if they get forced to put something, then they'll just say, oh, just put Alzheimer's. So Alzheimer's, this is a weird thing to say, but Alzheimer's wins. They get the stats because that's the thing that gets put on the death certificate. The reference numbers range anywhere from being the number 2 dementia to being the number 4 dementia, 30% to 60%, although according to some other dementias, it's 10%. And that's because dementias are mixed. And the only way to get a really good number is to have everyone have a full autopsy and to look for the Lewy bodies.
And I think I know the answer to this already, but are there any medications that treat Lewy body dementia?
There's no medications so far that actually treat any of the dementias, but for the new one just coming out for Alzheimer's, which we don't even know what the stats are, and that's extraordinarily expensive. The thing with Lewy is you need to, if you suspect it, get someone in for an MRI with and without contrast with a diagnostic radiologist in the room who can focus in on if they're seeing anything. That's how we got our diagnosis. We went to a university medical center with someone who teaches diagnostic radiology. So no, there's no medication for it. Some doctors will use Sinemet and some of the other anti-Parkinson diseases. It didn't do any good for her. It does for others. Again, it's everybody's brain gets taken apart differently and reacts differently. That's what makes Lewy so hard.
Yeah, I remember a woman that I worked with who had Lewy body dementia. And one thing I remember that really, sticks with me is that she had some really different behavior challenges that I wasn't seeing with other residents who had dementia. So just even as a really young social worker, that was probably my first experience with Lewy body dementia, but she was just very different than.
Really hard to get someone with Lewy into any kind of care situation. They can't go to daycares because they have to lay down. And daycares are not allowed to have people lay down because of licensing regs, because that makes it a bed. So it's one of those diseases. When you're in the Lewy body support groups online, you will see people say, I just finally got respite time and now it's 12 hours later and I got to go pick him up. Because they're so out of control and they don't want to be. And they remember that they were, and that's what's so hard. It's a disease that really takes your dignity in so many ways.
Yeah, so I know that you mentioned this earlier, and we'll make sure to include all of these resources in the video description, but could you just give us a quick run through for families that are watching this video, are identifying with some of the things that you're talking about, what resources, if they're not near you and can't receive your in-person awesome support, what resources are out there for families to start getting that support that they need?
There's the Lewy Body Dementia Association, and there's one here, one in England, one in several other countries. What I like more than anything is the Lewy Body Dementia Carers group on Facebook. It's a support group run by and for Lewy body families, and lots of people with Lewy come back after a death to provide support to the next group and the next group. And it really is the families coping with it who understand more than any doctor who has. Because you can be a specialist all day long, but until you've been up all night, you're not there. And so and that's my favorite one, because they've got a lot of people who are medical who chime in. They don't offer and they don't allow anyone to jump in with, ooh, coconut oil, or ooh, let's suck up some lemon juice in our nose and get that right. They don't do that stuff. No magic cures are allowed. They will block you. And I love that about that group. It's huge. It's international. And if you're up at 2 a.m, wherever you are, somebody's awake because it's 10 a.m. where they are. So there's always somebody you can talk to, question, vent to, and there's resources. The Alzheimer's Association has a pretty decent review of Lewy body. The National Institutes of Health has a pretty decent review of Lewy body, and there are some research programs going on right now that you can sign up with through the NIH. So there are some resources. They are far fewer than some of the other dementias. But I think, to my mind, and what I do for my families that I work with, is one-to-one support with people who've been there, and then finding a support group that's all the people who've been there, not people telling you, now you need to just talk to someone when they are agitated. Because with Lewy body, they're agitated and they think that you're, I don't know, your mother or Genghis Khan or somewhere in between. And talking is not going to help anybody, right?
Yeah, in a lot of ways that just can make somebody more agitated than.
Oh, it makes it so much worse, right? And the other thing you really need to deal with dementia is a sense of humor. If you can't laugh while you are coping with dementia, you are sunk. And it's not for the outside world laughing at the person with dementia, it's laughing at the situation. It's finding the humor where you can. And then I wrote a blog the whole time, because somebody needed to fill in people about what it's like trying to hunt down Lewy body, because everybody's wrong about it. Yeah. So there's lots of resources you have to hunt and peck. And you can find them on my website, but you can also find them on a bunch of other places. I'm not here to advocate to talk to me. I'm here to advocate that you find someplace where you can connect. And it's hard with Lewy to leave someone home to go to a support group. So it's easier to find an online one because you never know when a good day or a good moment is going to be.
Absolutely. And like I said earlier, we'll make sure to include a link to your blog because it is incredibly resourceful. So
Yeah.
yeah.
I find that most people get diagnosed because they know someone who knew somebody who knew somebody. They've been to 2 neurologists or 3, and then they hear about somebody and somebody says, wait, here, I heard about this. That's how most people get diagnosed. We got our formal diagnosis in April. Casper died in December. She'd been sick for 3 years at that point.
And do you think there have been any changes since then in the years since? Has there been more education? You know, when Robin Williams passed away, I think there was this, you know, all of a sudden people were asking what
There was
Lewy body
hope.
dementia was. Yeah. Do
And
you
it died.
think then anything
No,
has changed? No.
no, his widow seems to have gone more into, we need to raise money for research for brain disease, which we do. But there is not a lot of change or shift. Doctors are not getting more training. I meet with doctors who come to my support group for training. I meet with doctors who, when I was with hospice, who came to hospice for training. They got a week with hospice to learn how to do death and dying, which is absolutely pathetic in my very humble social work opinion. Because you can diagnose people all day long, but you have to tell them about it. And if you can't, it's not worth it. And they don't. 50% of doctors don't tell people they have dementia. And if you know there's dementia and the doctor's saying no, then you're like, what do you do? Most people aren't comfortable firing doctors, and you have to be. So I was on a committee in our city, the Purple Cities Commission, which died with the new mayor, but is back now because the volunteers are bringing it back this next week. And there was a neurologist on there, a retired neurologist, and we talked about Lewy, and he said, yeah, you're beating a dead horse. It's going to take another 50 years for doctors to recognize Lewy body when it walks in the room. They don't teach it. They get, 12 hours worth of dementia care training, and all they talk about is Alzheimer's. And now that they've got a new drug, they're going to talk about Alzheimer's more. Good for Alzheimer's. My mom has Alzheimer's. I have the genes for it. Good for Alzheimer's. Get the research. I'd like some for Lewy body, please.
Yeah.
And the Lewy body families that, we're speaking to today, you deserve the same amount of support.
Yeah.
You really do.
Absolutely. Well, I sure appreciate the work that you're doing, the support that you're giving families, and hopefully by, sites like ours, making it a topic that we're discussing and sharing with our audience, we're just going to keep, increasing the awareness and the resources that are out there currently.
Right. If it's not your family member and you remember this video, give it to the family that does need it, because that's how it gets around.
Absolutely.
Because it is sort of an orphan disease still.
Yeah.
Yep.
Yeah.
Thank you for
Jill,
having me. I appreciate it.
Thank you so much. Thank you for sharing your wealth of knowledge with us. I really appreciate it. And maybe, in a year or 2 or 5 or 10, we can have this conversation and things will be different. There's always hope for that.
I want that. I so want that.